Hello everyone, our presentation today summarizes research in the Ergonomic and Safety Lab at the University of Utah that is focused on understanding how active head positioning during subconcussive impacts reduces cervical muscle strain injury potential. I am Mohammad Homayounpour and my co-authors are Nicholas Gomez and Dr. Andrew Meriwether. In uncontrolled impacts such as participation in a sport or involvement in a motor vehicle collision, the sudden application of force to the head can cause an acceleration-deceleration event resulting in whiplash associated disorder or WAD. WAD is significant because individuals experience a much greater delay in return to work compared to those diagnosed with any other musculoskeletal disorder. In the United States, the incidence of WAD is estimated to be 4 in 1,000 persons, and the associated economic burden is estimated at $29 billion annually. One of the reasons for whiplash-associated disorder is soft tissue strain. A sprain or a strain occurs when applied force or acceleration exceeds the strength of the contracted muscle during the eccentric loading. A sprain or a strain is a function of rate of the muscle lengthening, which we measure that with linear acceleration, and also the level of muscle contraction, which we measure that with EMG. If we reduce these two factors, we can reduce the risk of WAD. So in this study, our central hypothesis was to evaluate if postural positioning before an impact reduced the risk of WAD. To study this effect, we created a safe head impactor capable of applying impacts in 4 different directions. We measured the linear acceleration using instrumented mouthguard and the level of the muscle activation with the wireless EMG sensors. The average of the max head impacts measured at 180 Newton. We tested 10 male participants, and for each one of these 10 participants we had MVC trials at the beginning, following by 7 impacts with omnidirectional warning, 28 with directional warning, and 10 without any warning, which we call that unwarned or control. So the directional that notifies the participant that they will have an impact, for example from front direction, in 1 second, and we ask the participant to lean toward the direction of the impact after they heard the sound, as you can see in the video. With omnidirectional warning though, we played another sound for the participant one second before the impact. This sound notified the participant about the incoming impact, but the direction of the impact was unknown for the participant and they just clenched. In the unwarned or controlled trials, there is no warning prior to the impact. The participant is waiting to hear a warning, but we had the impact without any warning. Let's jump into the result. We have sagittal extension, sagittal flexion, coronal lateral flexion to the right and to the left, and we have directional warning, omnidirectional warning, and unwarned condition, and we have muscle activation for the omnidirectional and directional warning, and also the linear acceleration for the 3 type of warning that we had. As 85% of whiplash associated disorder occurs during the rear end collision and it follows by sagittal extension of the head, we are just going to focus on the result with the sagittal extension movement. Preparation before an impact, either with directional or omnidirectional warning compared to the unwarned condition, resulted in 12.5% reduction in linear acceleration. However, there is no significant difference in linear acceleration between directional and omnidirectional warning, but if we check the activation at the time of the impact, we can detect significant reduction with directional warning in 6 out of the our 8 investigated muscles compared to the omnidirectional warning. As we mentioned earlier, magnitude of the damage is a function of the rate of the muscle lengthening, which is the linear acceleration, as well as the contraction of the number of the fibers that are getting torn. For a known magnitude and rate in muscle lengthening, pre-positioning results in less muscle activation for the same acceleration-deceleration profile. As a conclusion, if there was a warning system in a car to tell the passengers to lean forward at the time of the rear end collision, the risk of WAD will be significantly decreased. I want to acknowledge NSF and NIOSH for the grant, and thank you for